In the UK, the coronavirus pandemic was almost over, but now the Omicron variant threatens to set the country back again. This mutation could become dominant in the UK in a matter of weeks. Wellcome Sanger Institute geneticist Jeffrey Barrett told BBC Radio on Tuesday. He said, "I think we can now say that the variant is spreading faster in the UK than the Delta variant, and that was not clear until very recently. I'm pretty sure it is likely to become dominant within weeks." The epidemiologist Tim Spector from King's College in London also assumes that the Omicron variant will spread rapidly in Great Britain. It is realistic to assume that there are already 1,000 to 2,000 cases in the country. He says, and we expect that to double about every 2 days right now. He told that on BBC Breakfast TV. One can work out that this would lead to rather high numbers in just 10 days. According to Justice Minister Dominic Raab, this is not the reason for further tightening of the corona measures in the country. Triggering the so-called Plan B with contact restrictions and the call to work from home is not yet necessary thanks to the successful vaccination program, said Raab. Prime Minister Boris Johnson said in a cabinet meeting on Tuesday, according to his spokesman, that there are early indications that Omicron is more easily transferable than Delta. Last week, the head of government announced that all adults should receive a booster vaccination by the end of January. To this end, provisional vaccination centers should shoot out of the ground like Christmas trees. That's what the Prime Minister promised. But the second vaccination miracle in Great Britain does not seem to be really picking up speed yet. The elderly care organization HUK recently described the program as in chaos. It is alarming that a fifth of all nursing home residents have not yet received a booster vaccination, criticized HUK Director Caroline Abrahams, according to The Guardian. The number of vaccine doses administered over the past weekend in England was meanwhile even lower than a week earlier. And the number of infections in Great Britain, on the other hand, has recently increased again. It has been at a comparatively high level since July. The 7-day incidence was last given as 469. Hospital admissions and deaths have been relatively stable recently, with about 800 deaths and about 5,300 hospital admissions within 7 days. According to the UK government, 336 confirmed Omicron cases have been recorded in the country to date. None of those affected have yet to be treated in hospital, said British Health Minister Sajid Javid in Parliament on Monday evening. On Tuesday, the number was 437. Genetics expert Barrett explained whether the Omicron variant actually causes milder disease courses than Delta, as has been suspected. The accumulation of mild causes in Omicron infections could be related to the fact that the variant is able to infect a larger number of vaccinated or recovered people who already have a certain immunity. But even if only a small number of infected people become seriously ill, this could become a problem if the variant spreads rapidly. In response to the appearance of the Omicron variant, the government in London reintroduced compulsory masks in shops and public transport, as well as stricter entry restrictions. From last Tuesday onwards, travellers to the UK again have to submit a negative test result upon arrival. The government had previously put several African countries on the so-called red list with a 10-day hotel quarantine obligation. All immigrants must also take a PCR test upon arrival and remain in quarantine until they receive a negative test. Here in Germany, the number of confirmed Omicron cases is still very low. However, this could in part also be due to the fact that fewer virus genomes are sequenced in this country than in Great Britain. Incidentally, in the United Kingdom, more people died from alcohol consumption, by the way, during the pandemic last year than ever before. The British Statistical Office ONS announced on Tuesday that the death of 8,974 people could be linked to alcohol across the country. That is almost a fifth, with 18.6% more than in 2019, and the highest increase from one tier to the next since data collection began in 2001. Almost twice as many Minnesota women died as a result of their alcohol consumption. Liver disease due to alcohol abuse was cited as the most common cause of death with 77.8%, followed by mental behavior disorders due to alcohol consumption with 12%, and accidental or intentional alcohol poisoning was responsible for 6.2% of the deaths. The increase in the number of deaths was clear in all four parts of the country, but especially in England and Scotland, the authorities said. Data from England indicate that during the corona lockdowns with exit and contact restrictions, many people drank more alcohol. Experts blame stress, loneliness, and a lack of access to support services for the increase. In the summer, Public Health England has spoken of a set record for alcohol deaths in most of the kingdom. The number of people who drink alcohol at a higher and higher risk level increased by more than half in 2020, 58.6%, it said at the time. According to a report by the Organization for Economic Cooperation and Development, the OECD, around 36% of people in 11 countries surveyed said they had changed their drinking habits and consumed more alcohol during the pandemic. In Germany too, according to surveys, a third of adults drank more alcohol than usual during the corona crisis, especially in the first lockdown in early 2020. Apparently, this was particularly true of the age group of adolescents and young adults, where tobacco consumption also increased. Overall, however, according to the Federal Statistics Office in Germany, less alcohol was sold in the corona year. Per capita, beer consumption in particular fell sharply in 2020 compared to the previous year with 5.4%. In other words, due to the closed bars, restaurants and clubs as well as the cancelled events, every German consumed an average of 5 liters less beer than in 2019. And personally, I can just agree with that, because during the lockdowns and during the corona times without events, I haven't had any alcohol. I don't usually have a lot at home. When I know certain guests are coming, I go shopping, but I usually don't have much. I have a little bit of soju still left in my fridge, but that was just a test quite some time ago, because I always see that stuff in my favorite TV shows and wanted to try it, and I like the ones with the flavor, and really nice. But when I'm at home, I don't drink alcohol. That's because when we have no pandemic, there are so many events, and of course Carnival and all this stuff, where I drink beer, and that's so much over the year that I don't care to drink any at home. And now without all these events, I haven't drunken, I don't know, was almost nothing. So one or two beers on a session and on some meeting, and that's it. And I felt that because Carnival started again. At the moment, there's nothing going on because of the higher numbers now. But when it started, I could feel that, because I couldn't take as much alcohol anymore as before. Just after quite a small amount, I felt that, oh, I'm not drinking that much tonight. That wouldn't work for me, because my alcohol resistance of Carnival is kind of gone. And so I really felt that I was not drinking that much during the pandemic, and obviously in Germany that is not an unusual case with these numbers. But I'm really sorry to hear that there are more alcohol-related deaths in the UK. And I'll see you in my next video. Bis gleich.